Hi guys, my name's Laura. I am the operations manager at Paw Paddock, and today we are sat down with Dr. Charlotte Gray, the Vetsy Vet, just to find out a bit more about what they do and how it might benefit you guys as our customers. So we're going to go through a couple of questions and then just talk about, like I say, what Vetsy do and who they are.
Yeah, perfect. Thank you for having me.
Thanks for coming. Thanks for your time. So why did you set up Vetsy?
So we wanted to create an online veterinary practice which was there to be able to offer video consultations, treatment advice, including written prescriptions, which you could achieve all from the comfort of your own home. So there's nothing worse than having to either battle to get a cat into a carrier or take a really anxious dog down to the vet for an examination, or simply find the time in your busy schedule to book that appointment. So this is that option where you can essentially jump straight to the consultation at a time that suits you without all that hassle.
Yeah, it sounds very worthwhile. Definitely. And how does Vetsy actually work?
So it's quite simple. You just need to go to the website, which is myvetsy.co.uk, register your pet's details, and then select an appointment time that suits you.
Right, okay.
At the time of your appointment, you then just join the video consultation, and the vet can discuss all your concerns. Following your appointment, we'll then provide you with a really thorough summary plan of everything we've discussed, the treatment suggested, as well as any written prescriptions you may need. So often I find when you have a consultation with the vet, sometimes they talk at you quite a bit, and then you walk out and you think, what was it they even said was wrong with my dog? And so having that thorough plan to refer back to is just so helpful, we find, for people to then look at the condition, into the condition further themselves if they wish to, and also know what plan A is, plan B is, and medications that's been advised, including any potential side effects or complications with those meds.
Right, okay, yeah. And what does the £40 fee cover?
So it essentially covers your video consultation as well as any written prescriptions that the vet feels you may need. So there's no surcharge for a written prescription, and you can have multiple prescriptions off that as well.
Right. Okay. And how can Vetsy help my pet?
So research shows that 70% of pet concerns can actually be dealt with remotely, so via a video consultation. So if we look at the most common reasons why you'd bring a pet to a vet, it's often things like lamenesses and sprains, gastrointestinal concerns, so vomiting, diarrhea, skin complaints or allergies, behavioural concerns, weight management, aging changes, including arthritis, renal disease, adrenal gland conditions, as well as those cases that are just on long-term chronic prescriptions and just need to review their medication. So all of this is something that Vetsy can certainly deal with, and there's so much more as well.
Yeah, it sounds like it, especially taking the stress out of it for the animals, having to sort of get in the car.
Exactly. Yeah, just there's so much things that can be done remotely. It's certainly a new way to be looking at it.
So under what circumstances should I use Vetsy over an in-person vet?
So as a remote service, we are very open and aware of its limitations, most notably that being we're not able to prescribe antibiotics. So if it is something that you think you're looking for, we would advise that you see a direct veterinary consultation for that. Not every condition does need antibiotics, and certainly some can be managed through topical products instead. So we're more than happy to review. Equally, in the event of an emergency, we would say absolutely go to a direct veterinary appointment for that. So we're more than happy to triage a case and assess to see whether you need to be seen out of hours or whether something can wait till Monday morning. But if we do feel that actually it needs to be seen immediately, we would refer you. Typical things that we would not cover and suggest direct appointment for would be like an open wound, abdominal distension, respiratory difficulties, or potentially like severe abdominal pain, as well as any potential toxin exposure that you may feel your animals had. So in that case, we are affiliated with an out of hours clinic, so South Downs Emergencies in Chichester and Storrington, and we would say go straight to them and they can help you.
Right, okay, that's really good. So kind of first point of call, but then directing on if needs.
Yeah, absolutely.
Brilliant, thank you. That's really helpful to find out a bit more information about what if you do, and I know our customers will find it helpful as well, so that's really good. Also, we did a post and we were just asking our customers if they had any questions about their dogs, if they had any direct questions for you guys. So we've had a few good ones in. First one: why does my dog scratch their ears or lick their paws?
So the main underlying cause would be I'd be questioning whether there's an allergy component here. So allergies can present themselves in a variety of symptoms, whether it is subtle signs like chewing at their feet or scratching at their ears, or more generalized signs such as an overall itch or lesions on the skin or rashes. So if you have a dog that is chewing at his feet, it could just be a bad habit. And not necessarily anything to worry about. But what I would suggest you do is actually look at the paws and assess them. Look between the toes, first of all, especially in the summer. Make sure that there's no signs of grass seeds or anything nasty there. But then look right between all the pads and assess the skin. If it is red, thickened, inflamed, or there's some ulcerated sores there, to see that needs to be addressed before the dog's going to leave it alone. But then equally, I would question whether that is maybe an underlying allergy that's causing them, something they're in contact with that's causing them to have that inflammatory reaction. But similar with the ears, if you lift up your dog's ears and you look at the inside of the ear flap and the skin and it's looking quite red, or down the ear canals looking quite thickened, inflamed, or it's got a bad odour to it, or it's quite smelly, it could be that the dog has otitis externa, so an ear infection that needs drops to address it. But if you've actually got a case where you find you're constantly in and out of the vet clinic getting ear drops, then I would be strongly suspicious that your dog probably has an underlying allergy component, and that's why they're having that inflammatory reaction. And that's sort of the thing that you need to really sit down with a vet, discuss the triggers, discuss the trends throughout the year, and see if we can get to the bottom of what's going on and hopefully get some resolution long term.
Okay. And what should owners avoid during the puppy stages?
Oh well, so puppies need proper, regular and appropriate socialization to enable them to mature into essentially a all-round, well-adjusted dog. So it is really, really key that they are exposed to as many positive environments and experiences during those early few weeks and months, because it ultimately will influence the personality they become. So the first kind of, if you look at each little stage broken down, the first key stage is really those 0 to 7 weeks when they're there with their mum and their litter mates, and they gain so many social cues at this phase, from kind of bite inhibition to appropriate submissive behaviour, as well as learning to gain confidence around their siblings and other dogs. And then you go on to that phase where they end up going into their new family homes about 8 to 10 weeks. And at this stage, they are really impressionable. So it's really, really important to expose them to as many positive environments and controlled environments, essentially letting them meet as many people, other animals, children, lots of novel situations for them, and they can continue to develop a lovely personality. As they kind of get past that 10 to 16 weeks, it's a great time to introduce them into puppy training, puppy classes, puppy parties, really get them mixing with other dogs, but equally start to learn those training tricks and techniques that you guys can work on one-to-one, because not only are you developing that puppy's personality and behavior, you're also working on establishing a really lovely dog owner bond, and that often can then become huge later on in life. Following on from that stage, you typically get to that 4 to 6 month period. This is that almost pre-adolescent phase. So this is when they are very curious, very, very confident, and just want to discover and explore everything. They tend to be using their mouths a lot at this stage. So they are biting everything, chewing everything. And obviously at the same time they are teething. So from 4 months you start to get those adult teeth coming through. And then by 6 months you would expect like a full set of adult teeth there. So they do want to dig their teeth into all sorts. And do provide them with little comforts and kongs to do so. However, this is usually when they start to really test that bite inhibition again, and they can be when they're tussling with other dogs, they might be getting a little bit too carried away. And equally, if you've ever had a pup, you will know that they start to really use those razor sharp teeth on you as well. And it can be very, very painful. So that's really key to remind them of the appropriate response in that. And if they had done it to their siblings in the litter, they would yelp and move away from them and disengage from them. And it's exactly what you need to do. So a good yelp, stop playing with them for a short period of time before you re-engage with them, and then hopefully they will then learn not to keep biting and mouthing in the appropriate way. Going on from there, we then go to those teenage years. So that's 6 to 12 months, depending on the breed of dog or the size of dog you have. This is that real difficult, challenging time. This is when they can be really testing, and the need for stimulation and kind of mental drive is very, very high, and their tolerance for boredom is incredibly low. So they are very, very challenging. And it's typically when hormone levels are really, really high. So they're more likely to resist the training that you've already worked on so far, or be a little bit more selective with their recall. It will pass. So just really hone in on what you're doing and continue to establish that relationship. Really provide motivational kind of treats and rewards, and we'll get through it, I promise. Because soon enough, they'll be 12 months, 18 months, and they are fully matured adults, and life gets much easier again.
The other end. That's really helpful, because obviously we have a lot of customers that will use the paddocks for puppies, for training, recall, that kind of thing.
Perfect. Exactly what you want to do.
What is the best type of food to feed my dog? Is it wet, dry, raw?
So there's in all honesty, there's so much choice these days. If you walk into a pet shop, it's almost overwhelming with what to choose. And I completely feel like so many owners are lost in the right thing to feed their dog. And I really do feel what suits one dog is not going to suit another. So it really is quite a selective choice for you to make. And there is so much out there. Kind of, you've got your dry food, your kibbles, which are definitely the most convenient and cost-effective way to feed a dog, for sure. However, there's such a variety out there where the quality of it can significantly vary. So I do tend to say, if you're going to feed dry food, definitely reach for those top-end brands where they are scientifically formulated to ensure that they're nutritionally balanced and going to be more beneficial for your dog than something that's quite cheap. Saying that, then there's the wet food options, which some people prefer to feed. They are a little bit more pricier, and I find less convenient to feed. However, they are more palatable. So if you've got a bit of a fussy dog, then either feeding purely wet food or mixing wet food in with the dry is a good option. Raw food is one that's also grown in popularity recently. And I must say, I know many dogs that are on it, and they seem to do really, really well with it. There are some hesitations in the veterinary industry for feeding raw food, and it's purely the factor of kind of the bacteria that's associated with raw meat and its potential risks that it poses to immunocompromised humans. So just something to be aware of. And equally, if you are sourcing raw food, I would also advise make sure that you're getting it from a supplier who's a member of the UK Pet Food. Just ensures that certain standards have been adhered to whilst in the production of the food. And then there are kind of your more specific based diets, so diets that are tailored for kind of the dog's needs. So whether it's because of like weight management or kind of aging changes or renal concerns, you can get those sort of diets that are formulated for specific requirements. And then you've got the big one, which we seem to see more commonly these days, are dogs that suffer with either skin sensitivities or gastrointestinal concerns. Often need to be on specifically formulated diets for that reason, and there's such an array in that sector on its own. So whether it's something like a hydrolyzed diet or a hypoallergenic diet, or potentially the idea of a novel protein diet, and these are those diets where it's a sort of meat that they've never ever been exposed to before. So it can be like kangaroo or ostrich or even insects is the new thing. So, and it does seem to help those sort of cases, but in summary, there is so much choice, and there's not one diet that's suitable for all. So it is a case by case selection, really. And again, as a vet, it's our job to guide you on that decision.
Right, so this is a good one. When is the best time for a dog to be spayed or neutered?
Oh, yes. Yeah. So there's no one answer, I'm afraid. So in all honesty, you know, for decades we have advised dogs are spayed or neutered at 6 months, which essentially, by doing so, you're going to prevent the risk of unwanted pregnancies, prevent them from getting uterine infections, as well as significantly lower their risk of them getting mammary cancer when they're older, or even testicular cancer. So that's usually what vets have advised in the past. However, the guidelines are changing, and recent research has advised that for larger breed dogs, we actually delayed the surgery until they have reached kind of full maturity, so they're skeletally mature. Research has shown that certain conditions can be associated, or increased risk of those conditions can be associated with an early spay, in particular with the large breed dogs, such as kind of orthopedic concerns, potential risk for cruciate ligament injuries, and even particular cancers as well. So things like kind of your golden retrievers, your shepherds, I certainly would be waiting until they're like 12 to 18 months before I consider spaying them. But saying that, those small breed dogs, I still recommend you can be doing at 6 months, or at least allowing them to have a season and then wait a couple of months after that, so then you know they've reached that full sexual maturity. So it isn't just a one case answer, and definitely taking that kind of case-by-case decision on each one really is what's needed. But your rough guidance would be, if it's a large breed dog, let them fully grow. If they're small, they're more likely to be able to be done earlier, and those the benefits to spaying ultimately still does outweigh those risks. So it is still kind of the decision to be made based on that.
That's a helpful one for me. My puppy year-old lab, she's just had her first season. So thinking about that.
Yes, I'd probably do her like, I'd say about 3 months after, so she'll be about 15 months then, so I think that'd be perfect.
Thank you. I know we touched briefly on allergies in dogs, but what is the best remedy for allergies?
So, allergies will present, as I said, in a variety of forms. So if you've got those mild allergies, you can simply manage them at home. So the dog's just a little bit itchy or a little bit red, but not stressingly so. You could get away with that kind of particular shampoo. So any shampoo that has oatmeal in, it's got like an anti-itch factor that can really help alleviate that discomfort. Additional use of skin supplements. So you're looking for kind of your omega-3 and essential fatty acids, whether that's like a topical supplement or in the food, can really help improve that integrity of the skin layer, so it can just improve the overall health of the skin barrier, as well as the use of antihistamines. So they're really quite helpful, low cost solutions to try and keep an animal comfortable, especially if it's just seasonal and it's just as we get allergies. However, if you've got those more marked allergies where they are chewing at their feet, or they suffer with their ears, or they've got specific sores and they're just constantly tearing at their skin, they need something strong. Exactly. They're going to need something stronger, so a prescribed medication that can just take away the itch, stop the inflammatory reaction to whatever allergen that's triggering it all, and then sitting down with a vet to really figure out what's the trigger, what's the trends to these allergies and irritation. Is it environmental? Is it food? Formulating an appropriate long-term plan. There's no quick fix to allergies. So we have to just keep them at bay, and that's all you're aiming to do. They're the ones that take that time to really, there's no solution that's quick fix there, so we just need a little bit longer to discuss them.
But having that chat and getting that advice.
Exactly. Everyone's so different, and that's really what you've got to kind of get down to the bottom of, really.
What are the 3 main behavioural issues or concerns, and how should these be addressed or treated?
Big one. So I would say the kind of 3 most common behavioural issues that we see in practice would be separation anxiety disorder. That's quite a big one, especially since lockdown, COVID, everything else. The next one I'd say would be kind of reactivity and aggression, fortunately. And the other one I'd probably say would be like noise phobias. I see them quite a bit. So if we look at each one individually, starting with the separation anxiety, disorder, it's certainly not natural for a dog to be alone unless they're choosing to be alone. So these sort of cases that are suddenly left alone because we've all gone back to work after lockdown and so forth, they can really struggle with that, and their anxiety can be shown usually as you're about to try and leave the house. They start to pace and anxiously follow you around. It can't be left on their own, or it can get to the level where they are actually kind of, when you're out, they're being very destructive, they're soiling in the house, they're really vocal and highly distressed. It's distressed dogs. So it is something that does take a bit of perseverance and training to try and overcome. First thing I suggest doing is giving them like a space where they need to learn to kind of switch off and settle. So this actually comes back to when you look at puppies, and in that puppy period, in those first 12 months, as much as you want to sit and hold and cuddle puppies for 24/7, you really shouldn't. It's actually really important to teach them to have that time alone, to enjoy being alone, sit on their bed with a toy and play by themselves, or give them a little treat where they can happily be left on their own, because that allows them to switch off. And if you're not doing that, you're leading big problems later in life. Obviously, because of COVID, there's been a huge increase in the dogs that suffer with these disorders, and not all, it might be too late to be able to kind of correct it now, so we need to work on that. So first things is kind of finding a place where we can let them be alone. Now, if they are crate trained, then that's great, but not every dog is crate trained. So if not, I tend to advise putting up like a little baby gate where you can just isolate them away from you, have a nice bed that they can sit on, have something that's a really good positive distraction, so like either like a Kong with some peanut butter inside, or like a little licky mat, little scent cues as well, so using the owner's like jumper and leaving it with them so they've got that familiar smell, any familiar sounds. So if you normally have the radio playing in the background at home, keep that on, don't just suddenly silence the house. But what I tend to do is, when you're training them, start with that kind of setup, stay in the house, but just give them a moment alone without you, and then you aim to gradually increase that time apart until eventually you can start to leave the house. It's really important to have the dogs in a really relaxed state before you leave the house. So when you're trying to get your keys and your bag and everything to get out the door, that's when they're picking up on all those negative cues. Whereas if you've already got them settled in their favourite little spot, then you're going to have more success in being able to separate them away from you. There are added supplements that you can try, so like calming supplements, the pheromone diffusers can be really, really beneficial in just providing that positive environment for them. These things take time, so it is going to be kind of working on it slowly. So then moving on to reactivity in dogs, and the dogs that kind of demonstrate this or display these symptoms they usually have a history of kind of some sort of abusive or violent history there. So we see it more so now because there's a lot of rescued or rehomed dogs, or dogs that have been imported in from other countries, and therefore they are little broken souls, and it does just take that little bit extra support for them. The reactivity, they can demonstrate or display it in certain ways. It's just like a slight like lip snarl or a little grumble to like that eye wailing, or potentially the aggression as we know it, where they're lunging and kind of going and attacking other dogs. So it's really important to be familiar with your dog's triggers. We need to find out what it is. So if a dog hasn't been exposed to many people and children or other dogs, or potentially has a negative association with that, that's going to be his trigger. So if we can try and detect exactly what the trigger is, we then have to then address and kind of find out what their threshold is. So if you imagine that dog has a little bubble shield around them, and if they can see their trigger, that might be okay. But as soon as that trigger gets close enough to their threshold, that's where you get reactivity. So you almost need to not only detect the trigger, figure out what their body language is, see once they've clocked it, are they starting to roll their lips, are they starting to get tense and agitated. And in all honesty, I find these cases really do benefit working one-to-one with a behaviourist, to do so, because you've probably got to the stage where you don't even want to go and walk your dog because it's just too scary. I mean, it's lucky you've got Paw Paddock, because that's where you can get your enclosed spaces. However, if you do just want to pop them up for a quick walk, it can just be an unenjoyable experience, which is not what anyone wants as a dog owner. So I do think working one-to-one with a behaviourist can help identify the triggers, read the body language, because you yourself are going to be so tense as soon as you see that trigger, and that's what the dog's reading off you. And kind of a simple way of looking at it is essentially when you see the trigger, before we even get to that threshold level, we U-turn. So you have like a cue, like this way, turn around, get them away from it, take them away from that before they get to that sort of level, and then distract, reward, and hopefully build up confidence in that way. From a veterinary point of view, the other thing I do consider with these cases is you need to ensure that there is no sign of discomfort or pain, like chronic aches, things from old injuries that might be potentially lower in their threshold more, or lower in their intolerance level more. Even things like skin irritation can do that. So if you feel your dog has any symptoms of discomfort or pain, that ultimately has to be addressed first before you can work with the behaviourist. Otherwise you're setting yourself up for failure.
You're kind of focusing on the wrong thing.
Exactly. And then the last one, noise phobia. So potentially not so much a concern this time of year, but as we get to fireworks or potentially kind of thunderstorms, these incidences do crop up more and more. So kind of dogs, their hearing is so much more heightened and so much more in tune than ours, and that the sight of sound can be quite terrifying. So loud fireworks and kind of gunshots can be quite distressing for them, especially if they have been exposed to it in the past, and quite a negative uncontrolled environment. So they can be quite tricky to manage, and to kind of train them out of it, it does take weeks to months. So you can start to work on it, and I'd probably say if you've got a dog that really hates fireworks, I'd be working on it from now. The trick is that kind of desensitization and counter condition them. So I would aim to kind of play the sound on a low volume, in a happy, controlled environment of home, on their favorite bed, with, whilst you're playing with them, or with like a little treat, so they affiliate it as actually not such a negative experience, and slowly building that up till they kind of feel more confident around it. Obviously things like fireworks can be quite sporadic, or storms can be quite sporadic, and we're not quite ready for it. So if in the event one does occur, things to do is kind of shield them from it. So shut the curtain, shut the windows, pop the telly on, so we can try and muffle out those sounds a little bit. But these dogs, they want to almost hide. They usually try and seek out like a little den for themselves. So some react so badly. It's awful. So if you can provide them with a type of den. So again, if they're crate trained, perfect. I put a big blanket over the crate, like nice secure little den for them. But if they're not crate trained, don't force it. Like just provide a nice enclosure for them with kind of padding and cushions where they can hide under if they feel that they need to. And then there's always the options of those calming supplements. Kind of the same pheromone diffusers are brilliant for these sort of things. And equally, there are veterinary products that can be prescribed, which have like a type of very mild sedative effect, but enough to help them relax. So when they're in that zone, you can kind of help them relax, have them in a happy place, a happier environment, comfort them, play with them, give them little distractions so they're not so focused on it, and hopefully then they can get through it. But I would start really working on that desensitization now to try and see if we can get them to overcome it, especially if they're still quite a young dog.
Why do some dogs insist on eating grass?
Right. So, I mean, some people say it's because of kind of like a gastrointestinal disturbance. Others think it's because they aren't getting enough nutrients in their diet. In all honesty, neither of those have been scientifically proven. It's more likely just because they like the taste of it. And especially when it's this luscious and green like now, they're going to have just do that out of just a little bit of a habit. I'm very rarely concerned about the dog that eats grass. The only time I would be kind of concerned is if they're doing it to an excessive amount, where they're doing it so much so that they're making themselves excessively violently sick as well.
Okay.
Or if there's some other symptoms going on, for example, unexplained weight loss, or potentially like an altered appetite, or a little bit of diarrhea, then maybe there's more to it.
Yeah.
But the majority of the cases is just because they love the taste of it.
Didn't realise.
Yeah. If the thing I would say is, if they are grass eaters, it is quite important to ensure that they are up to date with their lungworm cover. So they may be also potentially ingesting slugs and snails when they are eating the grass, therefore potentially exposing themselves to lungworm. So if you do have an avid grass eater, it is perfectly fine, but it might be worth just ensuring that they have that lungworm cover there. Your standard flea and worming products that you can get over the counter in pet stores don't tend to cover it, so it needs to be more the prescription cover from vets, which will then protect them from that.
So, how will I understand if my dog is sick, and what are the main tells that indicate it's something slightly more serious?
Yeah, so, I mean, at the end of the day, no one knows your dog better than you. So you are going to pick up on when they are not quite themselves. You know, typically things I would be looking out for is if they just seem more lethargic or low in energy, wanting to sleep more than normal, if there's been a change in appetite or a increase in thirst levels. Obviously, if there's any excessive gastrointestinal symptoms, vomiting, diarrhea, they seem like they're in discomfort. Then, or potentially unexplained weight loss, you know, it's unplanned weight loss. These are all factors that would consider me to say you probably want to look into this further with at least an examination or an assessment, but potentially value in doing some blood work as well if needed.
What is toxic for dogs? Bit of a big list.
They absolutely. So the thing with the toxicities is there is a vast list of potential toxicities to dogs. The severity of the signs often depend on the toxin or the level of exposure. So I couldn't really list them all. And I wouldn't want to panic everyone about it. But I think there's probably value in knowing the big common ones. So chocolate is the big one. The rule of thumb is the darker the chocolate, the more dangerous it is. Grapes and raisins, they are considered toxic. They don't really know the known quantity that is toxic, because it's all to do with a reaction within the body that makes it toxic. So your dog may have one or two and be absolutely fine, and another dog wouldn't. And so it can cause quite severe renal injury. So just to bear that in mind. Artificial sweeteners. So xylitol is a ingredient of an artificial sweetener that is very toxic to dogs. So it can be found in sugar-free chewing gum, that kind of sugar-free peanut butter, and those sort of products. So just to bear that in mind. Onions, garlic, avocado, all can be toxic. And then caffeine as well is another one. That is obviously you don't want your dog on caffeine. The other thing, like, people quite like to try and self-medicate, and sadly I have seen a few cases where the dog's been given ibuprofen, so that is very toxic to them, and it does damage the kidneys quite severely. And in that argument, cats, we do them as well. Cats are very, paracetamol is very, very toxic to cats, so again another one it's an absolute no-go with them.
This is a helpful one for me, unfortunately. Why do dogs eat their own poo?
Well, to be fair, my dog does, so it's fun.
Good.
It's a horrible habit. So it is either just a really bad habit, or it can be that they are super hungry, or potentially a little bit of boredom or stress can cause them to do it. It very rarely is medically related. So, you know, if it is bad habits, usually the pups that are doing it, and, you know, if they are hungry and just excessively hungry, it might be worth looking at altering the diet slightly, and make sure that they're having what's recommended based on the packaging that you're feeding. But if not, or you find that they are still hungry, I'd probably put them on like a highly digestible diet, so one that's more for like gastrointestinal concerns, and therefore hopefully they'll be getting more from it and being more satisfied and not going out to eat feces. But if it is kind of when I tend to get a little bit more concerned about it is if it's like an adult dog that's suddenly doing it, it's very uncharacteristic of them to do. That could be a little bit of a telltale sign. Maybe there's something else going on. Equally, if there's kind of concurrent gastrointestinal signs, so intermittent vomiting, or their appetite suddenly change, or they have a bit of diarrhea, then maybe there's a reason behind it. So I'd probably suggest looking into that further in case there is like a malabsorptive, maldigestive issue and they're not quite getting what they need from their diet. Whereas if it is just the dog being gross, then we just need to try and stop them as much as possible. So kind of remove temptation, obviously pick it up. I know it's not always possible to get there in time, and try and distract them, so give them something else like a tastier treat instead, to kind of satisfy their needs, and hopefully prevent. There is I tend to recommend people put pineapple chunks on the food. By doing so, it changes the flavour of the feces. It's meant to make them a bit more bitter, and it can put dogs off it. Now, I must say, this is not scientifically proven. However, I recommended it for years, and clients always tell me it seems to work. So it's something to try for sure. And there's lots of products that you can also buy in pet stores that do claim to do the same thing. So all else fails, try that. But I definitely go with pineapple chunks first.
That's a good tip. Thank you. Right, final question. How often should I take my dog to the vets for a checkup?
Usually we would advise kind of once or twice a year, really, unless obviously you've got a pup or a geriatric who needs more kind of close monitoring or intervention at all. However, research actually shows that pet owners have on average 20 pet concerns a year, but they only typically will reserve their veterinary visits to those once or twice a year. So, through Vetsy, it's the opportunity to discuss those concerns. Sometimes it is something that's in the back of your mind and you're just looking for a little bit of peace of mind, really, getting a bit of simple advice, or potentially we could be addressing these concerns earlier before they've become anything more significant. So it is something to consider, that once or twice a year would be appropriate, but we definitely recommend don't postpone if in doubt.
Thank you so much, Charlotte. That's been really, really helpful. Good. I personally found it very informative, and hopefully a lot of our customers will as well. Obviously, you are now one of our partners, so you guys can find all the details on our website. There's a link direct to your website, and also on our social pages. You can link directly onto Vetsy and sign up as and when needs be. But thank you so much.
No, my pleasure.
We're going to have to do it outside. It's been really, really good. But thank you for taking the time to come and talk to us.
No, thank you so much for having me. It's been my pleasure.
Brilliant. Thank you.